Yep. You might step a little further away. Thanks. Okay, we're good? All right, good afternoon, everyone. My name is Gina Ford. I'm the Communications Director for Prince George's County Executive Angela Alsobrooks. I'd like to thank you all for coming. We've had some new developments, particularly in light of the governor's comments, but the county executive is now going to explain how some of our government operations will be altered in light of COVID-19. So first we'll have County Executive Alsobrooks, followed by our Health Officer, Dr. Ernest Carter, Congressman Anthony Brown, Prince George's County Public Schools CEO Dr. Monica Goldson, and finally County Council Chair Todd Turner.
Good afternoon. I want to thank you all so much for joining us today as we give some very important updates to our community. Governor Hogan, as you know, held a press conference earlier today where he took some extraordinary measures to keep safe all Marylanders and also to keep safe Prince Georgians. The governor has closed all bars, restaurants, movie theaters, and gyms across the state. This includes Prince George's County. He has prohibited all gatherings of more than 50 people across Maryland. And he's also expanded the number of state troopers and National Guardsmen to respond to the illness, and has made efforts to increase the number of medical personnel who will be available to treat all patients. As a result of these closures and the hardships that it could put on some of our families, we know that this will cause tremendous hardship for so many. We have partnered with the Capital Area Food Bank to host 3 pop-up food pantries. These pantries are for those who cannot afford to buy adequate food and who would ordinarily seek food and help from our food pantry. The details are being worked out at the moment. They will be announced very shortly through social media, our government website, and we will also send alerts out to all of our partners in the news media so that you will know exactly where to go. Our police department, and we want to thank them for the tremendous work they are doing, will also work with us in making sure that all mandates of social distancing are adhered to and respected. I also want to tell you this morning that I have declared a state of emergency in Prince George's County to ensure that we get the necessary resources that we will need to conduct this important work and to continue to keep all of our residents safe during the course of this pandemic. I would like to thank all of our county government employees for helping us. They have done everything they can to keep Prince Georgians safe. Many of them have worked throughout the weekend. They are working pretty much 7 days a week throughout the day, and I want to thank them and ask all of them to be sure to take care of themselves. We continue to reiterate that. I also want to thank Prince Georgians for their patience as we continue to work to provide to all of them the most accurate and up-to-date information that we can for our community. I am joined today by some really extraordinary people. I want to thank Dr. Carter, our Chief Health Officer, who is here and who will be speaking momentarily. I'd also like to thank Congressman Anthony Brown, who has been working with us around the clock to make sure that we have the critical funding that we will need from the federal government, and also will give important updates. County Council Chair Todd Turner, who's been a marvelous partner, who is here. He and all of our colleagues on the County Council, I want to thank them for working with the government so well. We've been working hand in hand. And Dr. Monica Goldson, CEO of Prince George's County Public Schools, want to thank her as well for the work that she and her team are doing. You will hear from each of them momentarily. I'd also like to thank some people who are not here today. It is our state delegation. They have literally been working around the clock in Annapolis to make sure, as you've heard, they intend to end their legislative session early, the first time in 150 years. But they have nonetheless, we've been on the phone around the clock to make sure that the critical funding that we need to come back to Prince George's County will be here. And so I want to thank them for their efforts and for their partnership as well. We have taken additional precautions to prevent the spread of COVID-19 among our Office of Emergency Management personnel. We have limited the number of people who come into this building, and also those who came in today will notice that as an additional precaution, everyone in our Emergency Operations Center has their temperature checked before they are allowed to enter the building. Prince George's County now has 11 confirmed cases of COVID-19. And while we know that more positive cases will come, I want to reiterate that good hygiene, effective hygiene practices, and social distancing are essential at this time to prevent further spread of COVID-19. We must all do our part. All of us must do our part in keeping safe our community, all of those, including those who are most vulnerable. But this can be prevented and contained, but it will require sacrifices on all of our parts. As a community, we can come together and we must to look out for seniors and others with compromised immune systems who are also at a higher risk of contracting COVID-19. In a few minutes, you will hear more from Dr. Carter regarding these at-risk groups, but I'm asking all Prince Georgians in particular to take the following actions to support our seniors. This can be a very, very isolating and lonely time, and not just for seniors, but for others. And so I'm asking every Prince Georgian, let's look out for each other. Let's really take care of each other. I urge you to call and check in on your neighbors, call and check in on those you care about, your friends, your coworkers. This can be a very lonely time, and we don't want anyone to feel isolated. So for our seniors in particular, ask you please to frequently call and check on them and make sure that they are okay. Consider bringing groceries to them and others who are not able, their medications or other supplies so that they can reduce their time in public. And if you have a loved one in a care facility, please monitor their situation, call in and check on them. But please call before you go to those facilities. I believe many of them have now have restrictions in terms of visiting, but we don't want to leave anybody behind. We're doing our part to ensure that our seniors are able to practice social distancing, but we want to make sure that they're also receiving the critical meals. They rely on us, a good number of them, through our senior nutrition program. And so the program sites are closed effective today. That is an announcement I wanted to make. And as a result, Family Services, in collaboration with our Department of Public Works and Transportation, will be delivering those meals to our seniors. Today, starting today, the Department of Public Works and Transportation transit operators will deliver a frozen pack of 7 meals to the seniors who would ordinarily come into our senior facilities. You should know that those meals will be delivered between 10 a.m. and 4 p.m. The seniors must be present or their caregiver to receive these meals, because the driver will not leave the meals unless someone receives them. The seniors will receive a call 5 minutes prior to the driver arriving at their homes, and the seniors or their caregivers, again, should meet the transit operator at the door for the meal pack, because our staff have been instructed not to enter the home. And so please, 10 to 4, please be present to receive those meals. I want to thank all of our partners in the media for helping us to get the word out to our seniors over the weekend by broadcasting this information so they know to be aware today. As we've said before, this is a rapidly evolving situation, and as we seek to create social distance, beginning today, I have closed all government buildings to the public. We have begun a tiered telework strategy in county government, so that some of our county employees who were approved in advance for teleworking also begun working remotely today. All other employees are reporting to work, but additional workforce reduction plans will be rolled out over the next few days. In addition, effective today, Maryland National Capital Park and Planning Commission, Department of Parks and Recreation, is closing all of its facilities and canceling all programs and events. Also effective today, the Prince George's County Memorial Library has closed its facilities and suspended library programs, outreach events, meeting room activities, and passport services indefinitely. All fines incurred during the closure will be waived. You should know that book drop-offs will be closed. However, all online resources will be available during the closure. In line with the state mandate to slow the spread of COVID-19, Prince George's County Public Schools, along with all schools across the state, are closed today through Friday, March 27th, to prevent the spread of COVID-19. We also have a number of students who are on free and reduced lunches in the county. So the school system is hosting a grab-and-go lunch pickups in the county. Dr. Golson will talk more about this in detail in a moment, but I do want to thank her again and her team who jumped into action to make sure that those meals could go out. Our Department of Corrections has suspended all non-attorney visits to the jail, and the Regional Processing Center in Hyattsville has been closed. Now, there have been no positive cases of the coronavirus in the jail, so we are really prioritizing safety at this time to keep it that way. The Department of Permitting, Inspections, and Enforcement will continue to function remotely by delivering license and permit services online. This is very important, especially for our business community. I want you to also know that the Prince George's County Financial Services, FSC First, is setting up an online payment service for loan borrowers and applicants. And you should know, and I know that Congressman Brown will talk more about this, because this time has been very, very devastating and concerning, most especially to many of our small and local business owners. But they should know that we are working, Prince George's County's Economic Development Corporation is working to inform the business community about Small Business Association disaster loans. So SBA disaster loans, and I know the Congressman will mention this in a moment. The Revenue Authority of Prince George's County is closed in its front office. There will be no walk-ins. The Prince George's County Economic Development Corporation will not be receiving visitors in its Largo office and will cancel face-to-face meetings. And although these events and workshops are not moving forward, we want everyone to know that the Economic Development Corporation will continue to work with partners and connect businesses with resources as they need them. Businesses contacting the EDC during normal business hours should leave a voicemail message. We are checking those around the clock, and we will be responding promptly. The Prince George's County Department of Social Services will keep DSS buildings open with limited access by the community. The Family Investment Division, which also processes benefits, encourages our customers, especially our senior customers, to apply for services and conduct business online. You should know that the Prince George's County Circuit Court has been ordered to close its operations to the public until April 6th. There will be a 24-hour drop box for pleadings at the Commissioner's Office. All pettit and grand jury service in the Circuit Court has also been suspended until April the 6th. And you can find a complete listing of closures and alternative services, to include the Human Relations Commission, housing authorities, and others, on our website, mypgc.us. As we work to keep Prince Georgians informed, I want to tell you that I will also host tomorrow evening, along with Congressman Brown, our council chair Todd Turner, and others who will be on and also our CEO of the school system will be on a teletown hall tomorrow evening at 6:30 p.m. to update county employees and residents on the government's response to COVID-19. County employees have received instructions to sign up through their county email, and county residents can also visit any of my social media pages at CEX Alsobrooks to find the link, or head to our county government website at mypgc.us to find details to sign up in quick form to fill out. So if you plan to join us on the telephone town hall, you'll receive an automated call and further instructions before the telephone town hall begins. If you don't want to be on the call but still want to listen, you can tune in to CTV channel 76, Verizon Fios 42 to listen live. We know that this is a rapidly evolving situation, and it is so important that Prince Georgians stay informed. You can do this in a number of ways. Call our coronavirus hotline if you have any concerns at 301-883-6627. You can also visit our website at health.mypgc.us/coronavirus and follow us also on social media at CEX Alsobrooks. Our coronavirus hotline is open for extended hours, including on weekends from 8 a.m. to 8 p.m. daily. And so we've also printed fact sheets, and we'll get those out to you as well. So I just, again, want to thank you all for coming out today. I certainly want to thank all of our residents who have worked with us to keep all of our neighbors safe. I do want to say that as we continue to work, it is important to know that we are not only working hard, but I want you to know that my thoughts and prayers are with all of the families and others who have been impacted, whose health has been impacted. I know this is a frightening time, but we're going to continue to work together, and we are going to contain this virus and to keep our residents safe. So I would like to introduce now Dr. Carter, who will come to the microphone for comments. As you notice, we are social distancing today to keep ourselves safe, but I'd like to ask Dr. Carter to come. He should be pleased with the social distancing. Have we done all right, Dr. Carter?
We've done pretty well.
Okay, thank you.
Thank you. Good afternoon, everyone. Just before we came out here, our team confirmed Prince George's has 11 new cases of COVID. I know you know I'm just going to give you an update about the ones that we have and the one that's currently under investigation, although we have several under investigation now. The fifth confirmed case is a man who's in his 40s. He's a close contact of our first case, which we had, which was a 55-year-old woman who acquired her COVID from out of town at a conference. At this time, he's not experiencing any symptoms. He is currently on self-quarantine at home. The sixth positive case is a female in her 30s, and her case is currently under investigation. She was hospitalized, but I'm happy to say she was released from the hospital yesterday and is self-quarantined at home. The seventh patient is a man in his 50s who has a connection with the sixth patient. He is currently hospitalized out of state. He has tested positive. The eighth positive case, which we were notified of yesterday, is a woman in her 60s who has recently traveled out of state. She is currently at home in self-quarantine. Our ninth and 10th case are close contacts of each other. They are a man in his 20s and a woman in her 40s who recently returned home from a trip from Europe. The man was released from the hospital. The woman is hospitalized, but not because of COVID-19, but because she has other problems. Of all the 10 cases, I'm happy to say that 7 have either recovered or are doing well. 3 are hospitalized, and we will continue lifting those individuals up in our prayers. The 11th case is still under rapid investigation. We just found out about it before we came, and so I'll give you further updates as when we come back the next time. Now, my message today should be very clear. We are not in a position to play around with this particular virus. We have to use social distancing. I'm going to tell you why. Because social distancing is our medicine for this virus. It's not the testing that everybody thinks. Testing is for public health officials like me who want to determine the spread. But it's the social distancing that's going to save people's lives. I have to say it again. Social distancing is going to help people save lives. I had a call today who told me about some seniors who wanted to go out and do we have masks for those seniors? I told them those seniors should be at home. They don't need to be out. They need to be at home. Social distancing is important because it prevents the spread. That's the medicine, not the test. We have people running in lines to try to get tested. The test is for doctors. And I want to be very clear about that because getting tested is not going to make you better. Whether you know you have COVID-19 or not doesn't make a particle of difference. What is going to make a difference? Well, it's going to be you covering your mouth when you sneeze, not being around people where you can get the virus, being home and keeping yourself healthy. That's what I have to emphasize. This is a time where we have to keep ourselves healthy. We're not going to get this overwhelming disease spread if we keep ourselves healthy and we use this social distancing. It's really what we have to do. It's only the doctor who can determine whether you need a test. And the doctors are testing so that we can determine the spread. So primarily, if you are a person who came in contact with somebody who has COVID-19, then we're going to test you. We're going to tell you to socialize. We're going to tell you to go. Don't get around anybody. We're telling everybody that now. But we're also going to test you. Or if anything happens in a nursing home, you know we're going to test those folks, right? We're going to test the people in the nursing home. And if you're in the hospital and you start getting worse, we're going to test you too, especially if you're having respiratory symptoms. But everybody else, we're not going to test. I've been a doctor for 40 years. I'm going to tell you right now, if I have a patient who calls me and they say, I'm having these symptoms, I'm going to follow the symptoms. I'm not going to worry about testing them for the flu or anything else. I'm going to test them only if I can't figure out what they have. Now, that's important. We don't need long lines of folks trying to get a test because you're exposing all the people in the line. I want you to stay at home. Social distancing. We got to do this. So one of the things I want to be very clear about is that if we don't practice social distancing, then we put our older people at risk. And so why are we shutting down everything? Because we've got to do this. This is a change in how we're going to be. And as the public health person, I have to be sure that this happens. As the doctor, I want to be sure that everybody gets better. I hope that's clear. Prince Georgians need to focus on following the advice of public health experts and stay in their homes as much as possible. This is teamwork. We have to normalize doing things a little differently. Yeah, it's going to be awkward because we're bumping shoulders and we're staying 6 feet away. But that's what we're going to need to do to get through this. This virus is coming at us fast and hard. I know you all know the last time I was up here, I said we have a few, now we have more. It's going to get worse. We're not going to be able to keep up with all of the positive cases. We don't need to. What we need to do is stay at home, do your social distancing. It's important. These are just temporary sacrifices. Right now, this is just to reduce the number of people around. It's temporary. It's not going to last forever, but it's got to happen now. It's really important that it does. This will slow down the spread of the disease. So this is a national call to action, social distancing. And when we say it, I don't want to say social. Just stay 6 feet away from people as much as you can. That's social distancing. Do that. That's our call to action. And I have to do this because I can't sleep at night. Because I know if I don't tell you this in the most forceful way I can, then I'm going to have people who lose their lives. I can't afford that. That is not why the county executive hired me. I have to protect lives in this county. I'm not trying to scare you, but I am trying to scare you. You know, as a doctor, and I have bad news to tell somebody, I tell them the bad news, then I tell them how to get through it. I don't hold it back, and I'm not holding it back from you all. What we have to do is do this right now. Don't go to the X, Y, or Z to play cards. No, you got to stay at home. You understand what I mean? It's not entertainment time. Netflix is on. Watch some Netflix at home. You know, this is not time for it. It's time for us to stay at home. So having said that, I want you now to take care of yourself. Get some sleep, eat right, exercise, catch up on the Netflix like I said. Stay at home. I want you to stop this spread. Thank you.
Thank you, Dr. Carter.
You're welcome.
Thank you, Dr. Carter. Also, thank you, Dr. Goldson, managing and leading two extraordinary institutions with tremendous responsibility in both health and education. Let me start my remarks by really commending the county executive and Governor Hogan for leaning into this. As we look around the country, it's at the state and local level where the work has been done and the difficult decisions are making. Yes, to implement the social distancing call to action that we heard from Dr. Carter, whether it's closing schools, teleworking, the libraries. In the absence of a vaccine, the best medicine is social distancing, and I think that point was made clear by Dr. Carter. But I want to really commend the county executive and the governor. Congress has taken some action to support federal agencies, state and localities as they combat this pandemic and to ensure working families get the help that they need. 2 weeks ago, we took our first major step. Congress passed an emergency $8.3 billion spending bill. Now, these funds are pushed to and through federal agencies down to the state and local level to procure medical supplies and pharmaceutical drugs, to develop new diagnostic tools and bring us closer to a vaccine. New testing methods have been approved by the FDA that should allow us to test more people and get results much quicker. And as Dr. Carter mentioned, that testing is primarily for public health officials to understand the extent of the challenge and how to apply public resources. This bill also allocated more than $2 billion for prevention, preparedness, and response, with $950 million reserved for states. So what does that mean for Maryland? The Center for Disease Control and Prevention plans to award $10.5 million to Maryland, and in fact, it's my understanding that that money was awarded today. In conversations with the state, they are developing a budget for allocation to the counties and also for funding statewide plans. 2 weeks ago, we also, as the county executive mentioned, we also provided $7 billion in low-interest loans to small businesses. It'll be administered through the Small Business Administration. It does require the state to take an administrative action, but in conversations again with the state, that process is already ongoing. And these loans could benefit approximately 90% of Prince George's County businesses. On Friday, House Democrats and the Trump administration forged an agreement to soften the economic impact on working families. The House bill included 2 weeks of paid sick leave and 3 months of paid family leave to 87 million workers at small and medium-sized businesses. That bolsters Maryland's existing paid sick leave law, which otherwise only requires 5 days of paid sick leave for employees. The sick leave program is also available under certain circumstances to self-employed individuals or owners of small businesses. This would strengthen, we also, 2 days ago, strengthened our state unemployment programs for workers who are laid off or furloughed during this crisis and who have exhausted their sick leave. This includes employees of the many federal contractors in Prince George's County, hourly workers, and service sector employees in Prince George's County. The provision would also allow Maryland to waive the work search requirement as well as the waiting periods. What we did 2 days ago, and the Senate should act on today or tomorrow, we support state and local efforts to combat food insecurity, as the county executive mentioned, by covering the cost of feeding kids out of school, families out of work, seniors, and ensuring that everyone who needs food assistance through SNAP or WIC gets it. This will benefit the 83,000, nearly 84,000 SNAP beneficiaries in Prince George's County. It allows Prince George's County Public Schools to continue serving grab-and-go meals to students, and it supports our county food banks, both in stocking food as well as in distribution and storage of that food. Finally, every single person, including those undocumented and uninsured, will be able to get a test for free for CV-19. Prince George County hospitals are ramping up new drive-by testing, becoming available this week. These are the first 2 steps that your Congress has taken to respond to this pandemic and to get us closer to recovery. Congress will advance more legislation in the coming weeks. My priorities moving forward are to make sure that everyone is following the guidance of social distancing, using every government resource to expand testing capacity and ensure we have enough hospital beds and ventilators, making sure families can focus on staying safe and healthy rather than worried about their bank accounts and unpaid bills. Prince George's County suspending all water shutoffs and evictions during this outbreak, which I commend. And also my priority going forward is supporting small businesses and workers impacted by this crisis, helping them weather a potential economic downturn. And perhaps most important, my focus is on supporting our county executive and our governor to make sure that they have the tools and the resources to meet the needs of the residents of Prince George's County and the state of Maryland. And I look forward to participating tomorrow on the county executive's teletown hall. Thank you.
Good afternoon. I want to first say thank you to our county executive, County Alsobrooks, our Congressman Brown, and Chair of the Board, Todd Turner, for their continued support of Prince George's County Public Schools. I am grateful that we have the opportunity now to expand grab-and-go meals from 9 sites to 25 sites beginning tomorrow. We've expanded our hours from 10 a.m. to 1 p.m. And in the grab-and-go meals, students have a breakfast, lunch, and a snack.
I appreciate the outpouring of our community and request and wanting to serve as volunteers at our 25 distribution sites. But at this time, we have to decline that request in an effort to comply with federal government, local, and state requirements to reduce the number of people who are located at a facility. And so I ask that you continue to support us as we make sure that we feed the 136,000 students that we have the opportunity to serve. Thank you.
Good afternoon. On behalf of my colleagues on the Prince George's County Council, we want to say thank you to County Executive Angela Alsobrooks, as well as our partners, Dr. Goldson, as well as all the county agencies and governmental agencies that are working with us today, including the County Health Department and here at the Office of Emergency Management. The County Council obviously is working hand in hand with our county government in response to this, obviously, health care emergency. So in alignment with the social distancing guidelines that we've been receiving both by federal, state, and local health officials, the council will be making several significant adjustments to our council duties, sessions, and committee schedules, and is reviewing alternate means of communication and public participation in those processes. We are currently, obviously, as the county executive released last week, in consideration of the fiscal year 2021 budget review. There are certain meetings that we are required to do by law, as is the case currently with the closure of the county facilities. Those are not open to the public, and we're going to use our technology when we need to conduct hearings to make sure that public participation is part of that process. In addition, as part of that, all county council appointed work groups, task force, and commissions are suspending in-person meetings and or hearings that are required. And the county council will be considering legislation in order to impact and address the issues with respect to scheduling, particularly related to some of our other council functions, including sitting as the district council, which is in our land use capacity, our zoning hearing examiner, and the Board of Appeals processes. So we'll provide more information, but as of today, with the closure of the county facilities, the county council staff is also in teleworking mode. So bear with us. My colleagues on the county council are making arrangements in their individual offices with respect to be able to respond to concerns that our residents have. And so just bear with us. Contact us through email. You can call as well, and we'll get back to you as soon as we can. We also encourage you, obviously, to utilize the number for any COVID-related matters at 301-883-6627, and to also see us on our website as well. So with that, thank you very much, and I'll turn it back over.
All right, we'll take any questions.
Prince George's County has had some of the highest visitation and due to National Harbor in Maryland. What are the concerns about the economic impact of this closing everything down, including MGM?
So we're obviously very concerned, not only about National Harbor, but we're concerned about the impact in general to businesses and others. We expect there to be significant disruption, and but right now our primary concern is the health and safety and welfare of all of our residents. We will be working along with all of our partners, including those in the federal government, Congressman Anthony Brown, the Small Business Administration, and others, to do what we can to extend assistance to businesses who are in need. But these are just really uncharted and unparalleled times. These are tough times across the board, and we do, we're very concerned about how this will affect every aspect of our community. But most especially right now, what we are trying to do is to save lives. And so we are doing what we can to comply with the governor's orders that he put in place today, which we believe will save lives. And we will work as this goes on to do what we can to assist our businesses who absolutely will see a negative impact.
This also means a loss of funds for them.
Oh, absolutely. Oh, absolutely. So we expect to see, and have already seen, the forecast, our revenue forecast will change. And so we're working with our budget office to know what that will mean for us. We expect the same to be true on the state level, but we'll see this all across the country, is that this will impact local governments. It'll impact our state government. And again, we will do whatever we need to adjust as we go forward. But right now, in this moment, Our priority is the life and health and well-being of our residents, and we will figure out everything else as we go along.
Just to check, did you mention, sir, that will there be drive-through sites setting up this week in county?
Repeat the question. Well, what sites?
Drive-through sites?
The driving. What I'm saying is that the Prince George Hospital, and I think Dr. Carter could probably speak better to that, is working on a drive-by testing site. Is there more you want to add, Doctor?
The hospital systems in the region are all trying to figure out how to best do the drive-by sites. So right now, I don't want to definitively say, but I've been in conversation with Luminous Healthcare doctors. I know that the Adventist system already have some, I think, in the district, and I think I actually have one right here, Prince George's County. The University of Maryland system, in conversations with them to see what they're going to do. And then, of course, MedStar. And MedStar has been very proactive, and so has Kaiser. So we're at this time, we're really working to see how we can best coordinate that. But I'm significantly concerned that we're going to have over people coming there, trying to get in. They don't need to be there. They need to be at home. So that's why I'm stressing that. So, but we are going to have these test sites for people who do need to be tested. And so that's, we're working in coordination with our health systems on that.
Working on also who will be able to go to these?
Well, the people who should be able to go are the ones who have a prescription from their doctor. I want to make that clear. You just don't show up to a test site. They're going to turn you away. You have to have a prescription. You have a prescription, you come in and get your test. If you don't have a prescription, don't come. Stay at home. That's what I want people to understand. And then take care of yourself and look for symptoms. Thank you.
And two more questions on hospital preparedness. I'm wondering if you can talk more generally about what you're hearing from hospitals in the area in terms of if they're ready with bed space, with ventilators, with other stuff like that. And then second part is that Governor Hogan said today that some hospitals might be opening back up. And I'm wondering if any of those hospitals are in.
I don't know the answer to the hospitals opening back up. I can tell you that we've had surge plans. You know, those are the plans for if all of a sudden everybody had to show up to the hospital. The way those beds are manipulated between hospitals, what new areas need to be opened up, how they are opened up. Sometimes, and especially you know, we have the National Guard deployed. Sometimes you can open up really quick places to do work that you need to do in medicine. Those plans are on the books. We're not there yet, but we know we have those in place. Sure. Mm-hmm.
And I'd just like to add one thing to what Dr. Carter said regarding people going and getting tested. It is important to realize those who have primary care physicians and have the ability to go and to get a prescription to get the test because they're concerned about their health should do that. But we also recognize that there are a good number of people in Prince George's County, first of all, who are not insured. 50,000 of them who do not have insurance, and many who do not have primary care physicians. And in that instance, we want people to still recognize that we have federally qualified health centers. We're going to be doing what we can to increase the capacity of those centers because we want to be able to care for all Prince Georgians, those who have health care and primary care physicians and have the luxury of going and getting a prescription and then thereby going to get tested. But we do recognize that there will be those who do not have that option. Because they don't have primary care physicians, and we want those people to know that we are working to make sure that their health care, that this is accessible to them as well. And many of those people are the ones who are showing up, who don't know what to do. And so we are going to continue to try to get information out for those, for our residents who don't know where to go, who are concerned about their health, and who want to be tested because they want to know whether or not they ought to be doing something to save their life or the life of a family member. So we recognize that this is a complex and evolving situation. So we agree with Dr. Carter that if you have a physician who can give you the prescription to go and get the test, we want you to follow that. But for those who don't, we'll continue to try to update the public as to how to get themselves the care that they need. So I did have a conversation. I was on a line with the governor and all of the county executives in the state, and what he said to us is that we'd be working together to increase the testing, the availability of testing. That he recognized that this was a challenge that we had that was passed on to us from the federal government, but he would be working. And today in his press conference, one of the things you mentioned that he indicated is that some of the facilities that had closed healthcare facilities that had closed. They would be working to try to get the funding to open those. So we will certainly continue to work with the governor in his administration in those efforts to make sure that we have healthcare available to all who want it and who need it.
More information now on private sector and what they're doing to help with the distribution of tests in the county?
I'm sorry, could you?
Targets and the CVS's and the other private entities that are supposed to be assisting with drive-by testing. Do you all have any clear understanding of how that's going to work?
I will get you more information about that. I do not have information about the private sector yet. I don't have specific information about that, but I will get that information and follow up with you and make sure we publish that information as well. But thanks for asking. That's a great question, but I'll make sure we get the information and share that with the public.
With the grab-and-go lunches, are those for all students or just students with free and reduced?
So the grab-and-go lunches are for anyone who shows up to the sites, any of the 25 sites.
Dr. Olson, just one, thank you. Dr. Salmon had mentioned that she will be talking to school system leaders, I think 2 o'clock. Will there be any possibility maybe you can give advice on for children and students who may not have technology, libraries closed, trying to get certain homework and other assignments done, what would be other ways that they can receive?
So we're grateful that the governor gave us a little bit of heads up in terms of when school would close. So all of our students on Friday received assignments for them to complete over the 2-week time period that did not require the use of technology and internet. As stated before, I represent a school system that has 82,000 students who are on free and reduced meals and who potentially do not have access to the internet. So I wanted to make sure that they still had assignments that could be completed. In addition, at the food distribution sites, starting on Thursday, we will also have hard copies of assignments for grades K to 12 as enrichment packets so that parents can have additional supports to make sure that there's no learning loss.
I was wondering if the faculty at Holy Trinity, if you all know if they're residents of the county or if they came from outside the county, if you have that information.
Right now, those cases are still under active investigation, and you know, we're under a lot of HIPAA restrictions. So that information will come out at some point, but right now we're not at liberty to say.
Okay, if there's nothing else, I thank you all for coming.